Hello, this is Dr. George Ganeem from Wake Veterinary Hospital and Urgent Care. Wake Veterinary Hospital and Urgent Care is a 24-hour general practice, emergency, and critical care facility located right off of Highway 540 at Knightdale Boulevard. At Wake Veterinary Hospital and Urgent Care, we pride ourselves on being a state-of-the-art facility, and we now offer digital radiology, the ability to do abdominal ultrasounds, the ability to do minimally invasive surgeries with laparoscopic equipment, as well as rhinoscopy and otoscopy, and we can now use vessel sealing technology to make many procedures easier and safer. At this point, I'd like to talk about some specific cases. We're going to start with a patient named Charlie. Charlie is a 12-year-old male-neuter Labrador Retriever that was found to have a splenic mass because of abdominal pain. He was referred to us by another veterinarian who wanted us to do the abdominal surgery using our vessel sealing technology. So we went ahead and made a routine ventral midline approach to Charlie's abdominal cavity and exteriorized the spleen. The spleen was quite large, so there was a little difficulty to exteriorize it because I was trying to have a smaller abdominal incision. With the vessel sealing technology, you don't need as large of an incision into the abdomen since you don't have to worry so much about your ligatures.
Try not to rupture it at the same time there.
After using laparoscopic equipment for a few years, it's really become clear that one of the greatest aspects of it is using a vessel sealer. The vessel sealer that we use is made by Aesculap, and it's called the Cayman. This piece of equipment is approved to coagulate and cut vessels up to 7 millimeters in diameter, and you can get them in multiple lengths and sizes. The one we typically use is 24 centimeters long by 5 millimeters, and this is adequate for both open and laparoscopic procedures. Using this, you don't need sutures or clips to control bleeding in many different procedures, but again, it's been very, very helpful with splenectomies. A typical splenectomy with a Aesculap Cayman takes about 10 or 15 minutes as opposed to 30 to 45 minutes. So the way the Cayman works is once you have an exposed vessel, you go ahead and clamp it, and then you press the button on the back of the unit. At that point, the unit denatures the hydrogen bonds and seals the vessels. Once you hear the 3 beeps, you know that the blood vessels within the jaws have been sealed, and then you can pull a trigger which then cuts that vessel.
That 3 beep sound.
We've used this equipment on quite a few splenectomies and have had no issues. Every once in a while you'll have a little bit of bleeding when you don't completely seal, but it's really easy to just go ahead and regraft that vessel and seal it. So with all these procedures, we have not had any bleeding post-op, and even with very large spleens, it's very straightforward and simple to use this vessel sealing technology.
It all went fine. And this can work on any size vessel?
Up to 7 millimeters in diameter. So, short of the iliacs and the aorta,
Yeah.
I don't know that you're going to see a lot of
Right.
7 millimeter diameter vessels. I've seen some big hilar splenic vessels that I would say, yeah. I think it's mostly coming from the actual spleen side of things.
And can you get the vessel sealer without the whole?
And now it needs to communicate with the generator.
Okay.
Is the problem. So the generator's really, I think, doing the work in that it's sensing the hydrogen bonds in the cells and telling it when it needs to be done.
And the ligature apparatus?
Very similar.
Yeah.
Yep.
But that is a one-time deal?
Only for human use company.
Right.
And in the human world, some hospitals are starting to reprocess stuff. Like they send it off to a reprocessing company that would re-sterilize it.
Oh, really? I didn't realize that was happening.
Yeah. So Medtronic is trying to get ahead of that game because they don't want to lose the revenue from the hand pieces. So they've made them, they put a chip in them, so when you unplug it from the generator, you can't re-plug it in. So it kills it. So for veterinary use, that makes it not so applicable. But same exact technology, same premise of, kind of low heat tissue sensing technology in the jaws. They go back and forth to the generator and tell you when it's done, and then a blade in between the jaws to cut.
Once all the vessels are sealed, we carefully examine the tissue to make sure there's not any active bleeding. And things went quite well with Charlie. We routinely closed the linea and then the skin, and you can see how large that mass was. There were definitely some other abnormal areas in the spleen, but really looked like one focal mass. We do go ahead and monitor these patients overnight to make sure they don't have any bleeding. Charlie did great. He went home the next day, and I'm pleased to announce it turned out to be, in this case, a benign mass, and Charlie's doing really well at this time. Another wonderful use for the Cayman vessel sealer is to assist in soft palate resections and brachycephalic dogs. We've found that with the ease of the Cayman, it's much easier to get compliance to do soft palate resections. All you have to do is grasp the soft palate with a tissue forceps and then simply grasp, seal, and cut. It usually just takes a few minutes to do soft palate resection. There's no bleeding whatsoever, and the patients recover quite quickly. With Wake Veterinary Hospital and Urgent Care being a 24-hour facility, we do see quite a few cases come in at night, and many times we do see pyometras. Pyometras can be sometimes complicated. There can be very large vessels and very friable tissue involved, and the Cayman vessel sealer again makes this procedure much easier with lower morbidity and makes it a much quicker procedure. In this clip you can see that the vessel sealer is being used to seal and cut vessels associated with the uterine horns and the uterine body. And again, this patient recovered quite routinely afterwards.
Mm-hmm. And you don't have to run the blade if you don't want to. So
okay.
If you feel like that's uterine artery and you want to just coagulate it, just coagulate it and then open their jaws.
Okay. There we go. And now we'll just, and if there's any vessels here, we can remove it, but I think we should be good.
Well, we've had several examples of using the vessel sealing technology on open procedures. Really, this instrument was developed for minimally invasive laparoscopic procedures, and we've incorporated that into our practice at this time, and we use it for quite a few things, including ovariectomies, cryptorchid surgeries, cholecystectomies, liver biopsies, splenic biopsies, and cystotomies. In this clip, I'm showing a routine ovariectomy, and I can honestly say after doing ovariectomies laparoscopically, I never want to do it in any other way. It's so easy to visualize the ovaries and all the blood vessels. You can do this procedure quite quickly and have no bleeding whatsoever. It's really ideal for both the patients and the clients. The patients recover very quickly and really only need exercise restriction for that first day. For this surgery, 3 trocars are placed. CO2 is attached to one of them. Once you insufflate the abdomen, you can visualize quite clearly. So one trocar is for the camera, the other is used to grasp the ovary, and the third is for the Cayman vessel sealer. It usually takes 2 to 3 applications to seal and remove each ovary. And again, the entire procedure can be done quite efficiently. Since I've started doing laparoscopic ovariectomies, I can honestly say I never want to do a typical spay again. With laparoscopic ovariectomies, you can visualize things so well. You can be absolutely sure that there's no bleeding, and the morbidity is very low. These patients recover quite quickly with minimal pain and only need exercise restriction for the first day. Thank you for watching this video. I can honestly say that using minimally invasive surgery and Cayman vessel sealers has changed the way I practice medicine and has really improved the care that I can give to many patients. If you have any questions or are interested in a consult, please call us at Wake Veterinary Hospital in Urgent Care at 919-266-9852. And I do want to say one more thing. VetOvation has really changed the way I practice medicine by helping me learn this technology and introducing me to it. It has been very beneficial to the veterinary field in general.